This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. Hospitals often describe violence as an unfortunate part of the job. Sometimes nurses are expected to manage, de-escalate, absorb, or move past. But sometimes the consequences of that violence are irreversible. Today's case file is a story of Lora Smith, a psychiatric nurse whose life changed forever after a workplace assault. What began as another shift inside an understaffed psychiatric facility ended in unimaginable loss. And this is not the first story, and I'm sure it won't be the last, unfortunately. And this story didn't end there, because what happened after the assault raises serious questions about how healthcare institutions respond when nurses become the victims. Lora Smith knew she wanted to work in healthcare from the time she was a child. By the age of 6, she had already decided she would become a nurse. Amazing. But like many people who eventually enter the profession, the path wasn't simple. Drop simple in the comment if you're picking up what I'm putting down. It wasn't simple. Before becoming a nurse, she worked at a variety of jobs, retail, delivery driving, and other roles, slowly working towards the goal she had carried since childhood. Eventually, she completed her nursing education and began working psychiatric care. That's a special calling, I have to say. Psychiatric nursing is one of the most challenging specialties in healthcare. It requires patience, emotional intelligence, and the ability to manage unpredictable situations. It also carries a higher risk of workplace violence than many other areas of medicine. You're dealing sometimes with people that are depressed, unstable, and it's part of the job. And that risk would soon become devastatingly real for Lora Smith. At the time of the incident, Lora was working as a charge nurse in a psychiatric unit in Iowa. The unit was understaffed. Like many healthcare facilities facing staffing shortages, the environment required nurses to manage high-risk patients with limited resources. One of the patients under her care was an adolescent male with a documented history of aggressive behavior. During a confrontation on the unit, the patient became violent. Lora attempted to de-escalate the situation, something psychiatric nurses do every day. But even with that, the situation escalated. The patient kicked her forcefully in the stomach. The timing of that assault made the event even more devastating. Just one day earlier, Lora had received news she had been waiting years to hear. Her IVF treatment had worked. She was finally pregnant. The assault would ultimately cause her to lose that pregnancy. The child she had hoped to welcome into the world would never be born. She later named the baby Levi. The assault itself was traumatic, but what followed raised even more troubling questions. After the incident, Lora immediately reported the injury and requested medical attention. Seems like the right thing to do. But according to her account, she was told she needed to remain on duty because the unit was short-staffed. Can you imagine? Just found out you're pregnant. Instead of being sent for immediate medical evaluation, she continued working in pain, emotionally distressed, and still responsible for patient care. In the days following the assault, she experienced worsening symptoms. Eventually, she lost the pregnancy. See, for many nurses who later heard her story, the most disturbing part wasn't just the assault. It was the response. According to Lora, the psychiatric facility had serious safety problems. She described an environment where multiple warning signs existed long before the assault occurred. There was no on-site security. Emergency communication devices were unreliable. Staffing shortages were routine. Training for violent incidents was limited. And in psychiatric care environments, these protections can mean the difference between a manageable situation and a dangerous one. Without them, nurses are often left as the first and only line of defense when patients become violent. After the assault, Lora says her injury report was initially lost. Her workers' compensation claim was denied. And when she eventually took time away from work to grieve her loss, she was written up for an unapproved absence. At one point, she was even required to continue caring for the same patient who had assaulted her. Now, eventually, Lora sought legal representation. Her attorney, Robert Recamper, I think is his name, I can't pronounce it, but he began pursuing legal action against the state of Iowa. The case argued that the state had shown what the legal filing described as willful and wanton disregard of a known risk. In other words, the danger wasn't unpredictable. They knew it could happen. It was foreseeable. The lawsuit claims the facility failed to provide basic protections that could have prevented the assault, or at least reduced the risk. Cases like this are rare in healthcare because workplace injuries are often handled through workers' compensation systems, which limit lawsuits against employers. Yep. When you take workman's comp, it limits your ability to file a lawsuit. But this case raised broader questions about accountability when workplace violence leads to catastrophic consequences. Now, there's some things I'm going to share with you that nurses should know. During discussions about the case, attorney Robert Recamper, I hope I'm pronouncing his name correctly, highlighted several rights many healthcare workers may not realize they have. Healthcare workers have the right to 1. A safe workplace. 2. Protection from violence. 3. Proper documentation of incidents. 4. Access to medical care after workplace injury. And 5. The ability to report safety concerns without retaliations. Yet many nurses say they hesitate to report violence because they fear disciplinary action or career consequences. This silence allows systemic problems to remain hidden. And despite the trauma she endured, Lora Smith has continued working in nursing. Bless her. She now works as a travel nurse, choosing safer environments where staff protections are a bit stronger. She has also become an advocate for workplace safety. Her message to nurses is direct. No job is worth your life, and no nurse should feel forced to remain in an unsafe environment. Her story has become a symbol of the urgent need for systemic reform in healthcare. The loss of Lora Smith's pregnancy is a tragedy that cannot be undone. But her story exposes a larger issue that affects nurses everywhere. Violence against healthcare workers continues to rise, yet many institutions still treat it as an unavoidable part of patient care. The question is no longer whether violence happens in hospitals. It does. The question is whether healthcare systems will take meaningful action to prevent it. Because every nurse deserves to go to work knowing they will make it home safely. The story of Lora Smith is heartbreaking, but it is also a warning. When workplace violence is ignored, the consequences can be devastating, not just for nurses, but for the families they hope to build. If you work in healthcare and have experienced workplace violence, retaliation, or unsafe staffing conditions, you can share your story anonymously at thebrokenshift@gmail.com. Because the stories that hospitals hope stay quiet are often the ones that need to be told the most. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.